Welcome, everyone. I'm Emily Sangster. I'm a long-range planner with the City of Beaumont. And with me also tonight is Stephen Rates, who is our municipal planning intern. So before we get into the session today, I also want to acknowledge that we do our work on the traditional territory of Treaty 6. And so we're acknowledging all those who share a deep connection with this land, including the First Nation, Métis, and Inuit, whose presence continues to enrich our vibrant communities. I will Stephen, did you have anything you wanted to continue with on this slide, or did you want me to move it forward?
Yeah, I think we're good to move into the meat of the presentation piece now that will set the stage for everything. So yeah, we'll describe what an age-friendly community is, just to provide background so we're all working off the same place and can have a good conversation. But the key piece here when we're talking about age-friendly communities is thinking about demographic change that is occurring societally right now. Global life expectancy, as global life expectancies increase, the share of the world's population that is 65 age or older is growing faster than any other group. And that's according to the World Health Organization from a study in 2018. And in 2016, the number of seniors in Canada exceeded the number of children aged 0 to 14 for the first time, and that's according to Statistics Canada. And so people often think of this demographic change where we're seeing more people aged 65 plus. People sometimes see this as a cost that we need to be thinking about, especially in terms of healthcare, and note that there can be economic challenges posed by having a large retired population in the proportion to the working population. But the World Health Organization, and I think we as an organization too, describe longevity as a triumph and a really valuable resource for individuals in society. This having more older folks in our community allows everyone to benefit from the knowledge, wisdom, and relationships that older folks can provide us with. And so aging can be a challenging process, but it's a really valuable process that we want to develop a strategy to ensure that our actions as a municipality can reflect best working with this population. And so the World Health Organization coined the term age-friendly community and has done an extensive amount of work in aging and health policy. And they describe an age-friendly community as one where the policies, the services, the buildings, and the public places both support and enable healthy aging, allowing everyone to reap the greatest possible benefits of growing older. So this includes, respecting for diverse needs and promoting full participation in society, regardless of your age. So now we'll shift into that next slide, where we will be talking about why this matters for Beaumont. And I think a lot of the time, what we may hear is that Beaumont is a very young, growing community. There's lots of young families here. But one key thing to note that's really important for this process is the share of older adults in the population within Beaumont is growing, as it has been elsewhere across the world. So we're seeing more older folks in Beaumont, and we want to be proactive. We want to be getting out in front of this in thinking about how we act on this challenge and how we can best build a community to reflect these needs. Beaumont often, prides itself on being a really innovative community. And so taking the time now for an age-friendly strategy allows us to be ahead of the curve, acting and not just reacting to issues. We can get out in advance of some issues and be deploying solutions that'll help build a better community. This is a keynote that we kind of acknowledged in the first piece, but when we plan for older adults, we also are planning for everybody. Communities that are safe and functional and welcoming for older adults are also very likely to accommodate residents of all ages and all abilities. This really rings true in the concept of 880 cities, where and within the philosophy of universal design, which considers access as a fundamental element a fundamental element of good design rather than making specific accommodations for specific groups. We build for everybody, and then we have a well-designed community. The benefits of planning for an age-friendly environment include improved resident health and community engagement, more business opportunities, and a wiser use of public resources in service provision, and that's according to a Government of Alberta study from 2012. And so based on this, the municipal development plan of Beaumont, which is our complete community, was prepared with public and stakeholder input over the 2015 to 2018 period. And that plan, which is like our main plan as a community, includes direction for the development of an age-friendly strategy. So now we're acting on that direction to develop this strategy. So this is the challenge that is basically presented to us, is to plan to make Beaumont a more age-friendly community and then follow through on doing that. So we've run through some information already, just wanted to provide an opportunity for questions quickly. So yeah, now maybe we'll shift into discussing exactly what an age-friendly strategy is, because we kind of thrown around the term and now we can describe it. There's a few key pieces of this. The first one is that an age-friendly strategy will include an evaluation or assessment of where we are now, so talking about that context. And then the second piece is setting that vision or the ideal state for the future that we hope to reach. And so then this third piece would be the action plan. So that's how we are going to get from the current state to the ideal state in the future. And so this action plan will assist Beaumont and city staff in following through with this vision, and the development of this plan is going to be supported and championed by the working group, which includes representatives from local seniors-oriented community organizations, service providers, and local residents. And then also we are including public input as well, which is tonight is kind of focused on that public input, but we'll have opportunities for public input throughout the process. So now we'll move to the next slide and take a peek at what the draft age-friendly strategy vision statement is looking like. So I'll quickly read it off and then we'll keep on going with the presentation. And then we'll get to the piece for the discussion where we'll start discussing some of these things. But the age-friendly strategy vision statement that's in front of us is Beaumont is an age-friendly city where the well-being and full inclusion of older adults supports an accessible, healthy, vibrant community for everyone. And so this was this statement was created in collaboration with the working group and is intended to incorporate a focus on the benefits of an age-friendly strategy for all ages. So yeah, this is our draft statement. And of course, as we work through the process, it may evolve, but we'll keep on going through this presentation and then get to the discussion where we can start having an impact on things. And so now to kind of compartmentalize age-friendly, we can discuss community dimensions of age-friendly communities. To develop a strategy in support of the vision that we just went through, we'll be using the World Health Organization's approach based on 8 different dimensions of an age-friendly community. And this is also, this approach of the 8 different dimensions is endorsed and supported by the Public Health Agency of Canada, as well as provincial governments. So the policies, facilities, programs and services in each of these areas can support how well people can pursue healthy aging in that community. And this includes both their physical and their mental health, as well as their independence and their financial well-being. And so some of these categories relate to hard infrastructure, while others are softer and less tangible, but still really important to the process overall. And so we'll quickly rattle through these just to provide some examples. But when we talk about the dimension of outdoor spaces and buildings, we're thinking about the design and condition of spaces. So one really good example here is like, how are we building sidewalks, or what kind of benches and where are benches being provided in the community, or what is lighting like, and does that take an age-friendly lens, and what kind of lighting treatments we choose to use in the public realm. So that's just one example, or that's one of the dimensions. The next one would be transportation. So overall, we're thinking about the availability, accessibility, affordability of a range of transportation options, and thinking about, all right, so we have older folks in our community, what would their specific needs be, and how can we provide them with transportation options that would ensure they have equitable access to the community. The next factor, housing. We're thinking about the design, the location, the affordability of a range of housing options. And again, that options piece, what kind of options do age-friendly, or does older folks in our community need? And how can we ensure that this these options are provided for the community. Social participation is another key one, and it's great to hear already in some of our chats so far about social clubs and groups focused on seniors. This dimension is focused on the opportunity to participate in those social, cultural, and recreational activities of choice. And so how is that supported by the City of Beaumont? That's what this strategy will discuss. Respect and social inclusion is the fifth one we'll cover really quickly, and this is just the attitudes and behaviors of the community towards older people, and does the city have a place in shaping or providing opportunities for learning about respect and social inclusion. The civic participation and employment piece, that civic participation piece already rang clearly through, but that's the opportunity to take part in citizenship, volunteering, economic activities. How do we ensure that older folks have those opportunities? What can the city be doing to help support that? Communication and information, the ability to access clear and relevant information about all aspects of community life. And I think we've already heard a couple of good ideas or some passion behind this idea already. So we're excited to look at that more. And then the final one is community supports and health services. The ability to access high quality, affordable healthcare and community services is one of the final dimension that we look at when we think about crafting an age-friendly strategy. And so does anyone have any questions about the community dimensions that we just ran through? And up next, we're going to be talking about process, which is really important for a lot of folks. How are we doing this work? What's happening next? Where are we at? So we have a little timeline here that showcases where we've been so far, which is that assess needs and develop a vision. And it shows where we're currently at, which is the star, engage the public. And then the next steps follow that. But I'll just run through these really quick. We're using a similar approach to what most municipalities around the world are using, and this is kind of the best practice when it comes to age-friendly strategies. We start with that understanding and documenting the needs to be addressed, and then developing a vision, that ideal state, as well as some goals for where the municipality would like to end up. So that's the work that we've done so far. And now we're engaging with the public as well as stakeholders in a discussion of those needs that were identified within the vision and the goals and what we should be doing in response. Kind of like a where we are right now, and then trying to survey and workshop some of the ideas that we may have to get to the ideal state. So that kind of that action plan piece is what we're in the process of developing. And then once we have all those pieces together, we move into the next step where, yeah, we work on creating all of those pieces, putting them together into developing a plan based on what we've heard so far in the engagement. And then, of course, we want to do our due diligence. We circle back to the stakeholders to confirm that we've gotten this approach right. And so this would be occurring in the winter or spring, but we want to, we're in very strange times right now, so we want to ensure that we're respecting the context that we're in regarding COVID-19. So that checking back in will occur sometime in the future months, and you'll have lots of lead time to understand when that'll occur. And then the final step is bringing the finalized strategy after it's been double checked by stakeholders, bringing that final strategy to the municipal council for adoption. And then once that's been adopted, if council decides to move forward with it, then that begins to impact the decisions the municipality makes moving forward about what kind of programs or services are run or how spaces are designed, and thinks about those community dimensions that we just ran through, and applies an age-friendly lens to the decisions we're making within those dimensions. So yeah, that's the process that we're working through. And now we'll move into the next slide, which is discussing the key findings that we've found or identified so far. And I think this is, Emily, where we're shifting, correct?
Yeah.
Okay, awesome.
So, yeah, I will, I'll spend some time chatting for a bit. Thanks, Stephen, for kind of running us through the background and the process. Before we kind of get into a bit more free-form discussion, I just wanted to talk a little bit about what we've heard so far. As we mentioned, we're kind of looking at what needs people see in the community right now. And so in addition to the first working group meeting, we've also had the community survey running, as you both know. And then this public workshop that in normal times we would have in person, but we just aren't able to do that right now. Some of the key things that have come out of those initiatives, I think if there was a single clear need that was really being expressed, it would be the transportation options. People are telling us there aren't a lot of transportation options in Beaumont for those who don't drive. And because this affects so many other dimensions, it's something that I think is coming through really clear in what people are telling us. We're hearing that safety and comfort in public areas is a bit of a concern. So people are saying there's a need for more benches, there's a need for better snow removal in the winter for safety. There are places where there aren't enough good sidewalks and walkways to feel safe walking around traffic, and also just things like shade and things that make it comfortable to be outside in public areas. Housing options are another thing that has come up. A lot of people have noted that the larger single family homes in Beaumont don't work for many seniors, and so there's a need for more affordable options and more options that don't have stairs. Volunteer recruitment has come up as well. Sometimes there's kind of a gap between organizations that might need volunteers and people who are looking to volunteer, and they don't always connect. And this can sometimes lead to a risk of burnout for the people who are volunteering, who get called on again to volunteer, and it becomes a load on those people. We've heard that our communications and event promotion at the city could probably be better. We're hearing that people maybe don't know where to look for events or information, or they wind up hearing about things after they've already happened. So there may be some actions that we can take there to get people more engaged in events and just make sure that we are combating social isolation as well, which is especially relevant in this COVID time. Health and support services. We were hearing from folks that they feel that there's a lack of doctors in Beaumont specifically, and also services based in Beaumont rather than elsewhere that are doing things like home health care, grocery delivery, and meal delivery. They may exist, but people have said that they often have to look beyond Beaumont to find those things. And lastly, we have been encouraged to keep affordability and cost in the back of our minds. We know that a lot of programs and services in Beaumont are affordable to many people, but we did hear from some people for whom cost has been a barrier to really taking part in all the things that the community has to offer. And so we're keeping that in mind as well. So as we go, we're going to be taking a more detailed look at these needs, any comments that you have today as well. And we'll be preparing an overview of the needs and a draft action plan to share with the community later on, the next time we come back and check with the public.